Welcome everyone to our monthly webinar for weight loss surgery in Mexico. Um, we're going to start. Just to make sure everyone has filled out a health questionnaire on our website to participate in our raffle at the end of the presentation. So we want to make sure you already have submitted a health questionnaire by going to mexicobariatriccenter.com/health-questionnaire. And if you have submitted your HQ before, you don't have to do it again. If you have not, please submit one and select Dr. Miguel Montalvo as the surgeon of your choice and watch the webinar all the way to the end. That's the requirement to be able to participate in the raffle at the end of the presentation for $2,000 off of your package, surgery package. I have Dr. Montalvo with me this morning. Of course, we are in California. I am in our office in Sacramento, California. My name is Ron Ellie. I'm the CEO and founder of Mexico Bariatric Center. And Dr. Montalvo is joining me from our facilities in Tijuana, Mexico. Um, we try to answer all your questions in the presentation. However, if you did not hear um, the subject or the questions you have in the presentation, you can type it in the question and answer Q&A tab, and we will get to it at the end and try to answer as many of your questions as possible. Our topics for our presentation today is going to cover what is obesity, risks of being obese, weight loss surgery, intervention. We talk about MBC, Mexico Bariatric Center, and Dr. Montalvo is going to cover the type of bariatric surgery that are out there and the ones we cover, all the laparoscopic and endoscopic procedures, all the revision procedures, and we'll talk about how crucial bariatric vitamin is for your post-op recovery. And at the we will have the Q&A session before we do the raffle at the end for the $2,000 off. Obesity is a disease that is growing worldwide, including United States. Human is not, throughout the history, human has not been exposed to so much calories, and it was hard to find food, and physical activity was unavoidable. But the modern day lifestyle has exposed us to high calorie food, and we're not walking or we're not doing as much physical activity. That's one factor. And all the sugary drinks, and again, the fast food, high calorie food that we exposed to. Of course, genetics has a lot to do with this. and how we've been brought up, our developmental history, and what we are exposed in our environment. Stress is a huge factor. When we stress, we eat, stress eating, overeating, and inadequate sleep, and of course, the drugs that we may take that is contributing to gaining weight. So, by definition, in like a medical terms, they use BMI, which is stands for body mass index, and there's basically a simple formula that you plug in your height and weight, and you come up with a number that puts you in this chart. Anything below 25, of course, is normal, and between 25 and 30, you're in like a gray area of where we are in the overweight area. After 30 is called obese, and after 40, of course, then is called morbidly obese and super morbidly obese and super morbidly obese. And one thing about our surgery center is that we are not limited to what BMI we can handle. We don't stop at a certain BMI, not being able to perform the surgery. We do BMIs of even 100. We've done 102, 104 BMI patients. Um, so when we gain weight, it's not just we are adding more fat cells, or they call them adipose tissue. Adipose tissues also are changing their composition. If you look at the picture on my right side of my screen, you see a difference between adipose tissue of an obese person versus adipose tissue of a lean person. And you see that the composition is totally changed. The structure of the fat cells are changed as well. So this changes is responsible for us not be sensitive to insulin anymore, which is like diabetes type 2, not sensitive to leptin, which means we don't feel satiety after we eat. And of course, we're not responding to therapies as well, or even responding to vaccination as well. Obesity, of course, we all know, has major risk factors. Especially after COVID, we realized how important it is. It's affecting 40% of adults in US. And I like to show this very quick video of what happens to the abdomen fat in the abdomen when we gain weight. Of course, like we said, the risk factors associated with obesity is diabetes type 2, cardiovascular disease, lung disease, impaired immune system, chronic inflammation, blood clots, sleep apnea, certain type of cancers. I mean, the list is going on and on. So again, like we mentioned about when COVID hit, we realized that how sensitive we are to, viruses like COVID. If we are overweight, we are even more susceptible. And the reason, of course, the more fat cells you have, the more breeding ground you have for viruses like coronavirus or COVID-19 to get attached to. And that's why you experience the disease harder. You end up more in the ICU, and there is more chance of dying because of obesity. Of course, the the cure for obesity has always been the first choice or first thing that comes to mind is diet and exercise. So many people try diet and exercise. You may lose weight for a while, but it's not sustainable. And therefore, we don't, I mean, diet and exercise is great. You always have to exercise regardless, but it's not a proven long-term solution for obesity. Then it becomes drugs. So there's been diet pills, um, and then recently the Ozempic injections, and these are also not a long-term solution to cure obesity. The only, at this point, the only proven, quick, safe, and long-term solution to cure obesity is weight loss surgery procedures. Uh, Ozempic is gaining traction, as we know, in the social media. There's a lot of talk about this. Celebrities is getting on the Ozempic. A lot of people getting on Ozempic. So Ozempic is basically a drug that was originally made or designed to help with the diabetes type 2, to bring A1C, hemoglobin A1C levels lower. And then it had the side effect of losing weight. Now, the people who are non-diabetic also are using it to lose weight, which is questioned because, the long-term effect of hormones, synthetic hormones being injected in your body. So we talked about why diet and exercise are not a long-term solution, because the minute you start going on diet, your metabolism goes down, your hunger goes up, and your satiety goes down. And these are like a hurdle to get to that goal of losing weight and your goal weight. Now, if you look at what happens in weight loss surgery, in weight loss surgery, when they make changes to your gastrointestinal system, your hormones change. As a result, your brain hormone interaction changes, and you basically resetting your metabolic system. So this is like a natural way of losing weight because you're getting rid of some of the hormones that create hunger. And as a result, a lot of other hormones gets changed, like GLP-1, and they internally making all the changes. So the demonstration on my right side of my screen shows that what happens when a person who is 250, that their body, their brain, and gut hormones are interacting at that level. So their thermostat, the body thermostat or metabolic thermostat is set at that weight. If this individual goes on diet and exercise, we talk about boot camp type of exercise. And let's say they manage to lose 75 pounds. And this person goes down to 175. Now the brain still see that individual at the 250 pound and wants to do the same thing at that level, that's why you get more hungry and your metabolism goes down. The first week or two of diet, and after that, the body is not losing more weight because of this. Because you get more hungry and your metabolism goes down, it doesn't burn fat anymore. Now, when you do the bariatric procedure, the minute you wake up from the operation, your body, your brain is going to see you at the 175 pound. So your metabolic system is reset, your thermostat is reset, and therefore you're not going to get as hungry and the metabolism goes down. That's why you lose weight fast because your metabolism goes up. So the question now is, okay, so how do we get this weight loss surgery procedure, which is a life-changing, life-saving procedure that adds years to your life. It adds quality to your life. Of course, if you have insurance in US, you can go through them. If you're not insured or your deductibles is more than what you pay us for a top high quality surgery packages, we are your option. We are a medical tourism company that takes you to Tijuana, Mexico, and get this procedure done at a discounted rate. Um, of course, when you are selecting which company to go through, you have to make sure you are safe as far as that facilitator or company takes care of you from the time you arrive, from the time you leave, which means you would have transportation, you will have hotel arrangement, they will have staff to take care of you all along. And this is actually a CDC recommendation for medical tourists. And of course, make sure the facility is accredited and the surgeon is well known, is not just the assistant surgeon that just been doing some surgery here and there. And another piece is buy medical tourism insurance. So medical tourism Mexico Bariatric Center is basically quality medical care with VIP treatment. Of course, again, when you're searching a company, make sure they're not just a fly-by company that has some TikTok and some before-after pictures on Instagram or Facebook. It's very easy for anybody to put some before-after pictures. They could be even fake or they could be photoshopped, right? And then they just have that one page up, and you just trusting that surgeon or that company for that one page, not looking to see, is this company has been around? Is this trusted organization? Do they have support before and after? Am I going to be able to reach them in another year or two or four? So that's why Mexico Bariatric Center is one of the older companies that has been doing that. We've been in operations in 2012. We have an office here, main office in Sacramento, California. And since inception, our goal has been to offer weight loss surgery, highest quality weight loss surgery procedures in Mexico with the most affordable prices. And here's a bulleted items of why choose MBC. Our reputation, our reviews, are matching the patient with the best, the right surgeon with the right procedure. That's huge. We do have a U.S. surgeon liaison that looks over every health questionnaire that is submitted and reviews it with the surgeon down in Mexico. Um, our packages are all inclusive. The safety, the procedures, the wide range of procedures that we offer. We are a Better Business Bureau, A-rated. We help you with FMLA paperwork. Our We offer medical tourism coverage. Of course, is optional, but we have a discounted medical tourism complication coverage. We do give you support, lifelong care and support. Our complications are low. So the list goes on and on. And now we've been working since the beginning of 2020 on our own surgery center that should be ready hopefully soon. We are doing the finishing touches and working on getting the licenses to be able to start. Um, this is some of the pictures that shows the center, what to expect. Um, this is early on with Dr. Valenzuela. This is during COVID. Um, so we talked about the medical expertise that Mexico Bariatric Center works with. Um, so we have performed over 20,000 successful surgeries, and we work with the 7 top quality bariatric surgeons, the best surgeons you can find. And our packages that has surgeon fees, hotel nights, hospital nights, pre-op, post-op tests, hospital fees, of course, nutrition support, transportation, private transportation, aftercare support, and medical tourism optional, of course, coverage. And each package covers a hotel night and 2, 3, or 1 night in the hospital. Our processes are very simple. You fill out a health questionnaire, and um, you choose, when if you know the surgeon. If you don't, we assign you to the best surgeon that matches your profile. And once you get their approval, you pay your deposit, and now you can book your flight or arrange for your driving to San Diego Airport and finish up your paperwork, your passport, all that, and you're ready to go. Support is a huge part of the success post-op. Of course, pre-op too, because pre-op shows your commitment to this procedure to be able to succeed long term. And therefore, we have several Facebook groups that make sure that you are on your way to successful surgery. And our main group, which is our past patients, has over 10,000 patients currently. And we have another group which is called Inside Facebook Support Group. Those are the people who are coming on board, or they are on the fence. Of course, we have some of the past patients there too. And we would support you before and after surgery. So we make sure that you are set up for success. We have several of our past patients as our affiliates working with patients. Sarita is our Facebook guru that has been moderating this group for so long. Rena is our past patients, John and Kelly, Elizabeth. There are some that their pictures are not here, but they're here. Megan, they're here to support you as well. They do have actually, Sarita and Rena have a podcast that is very interesting. I suggest that if you have time, definitely listen to that. Um, so So basically, you fly, you drive to San Diego International Airport, we pick you up. We like you to be there before 12 o'clock, 12 p.m., noon, and pick you up and take you to our facilities to do the pre-op. And your departure, we like you to be after 2 p.m. And um, basically, once you land or we pick you up, you don't have to worry about anything because everything is arranged. Just relax, listen to what you have to do next. They tell you like show up here, show up there, at what time, and you should be good to go. Okay, for people who joined later on when we started, basically I want to make sure if you have not submitted a health questionnaire, go ahead and do so. If you have, you don't have to worry, and you have to wait and basically watch these webinars to the end to be qualified for our raffle for $2,000 off of the package. We talked about the exclusive network of best bariatric surgeons in Mexico. So as you see, we have 7 team of surgeons, and well, one is missing, Dr. Cabrera, but Dr. Miguel Montalvo, that I have a pleasure to be with today, Dr. Louisiana Valenzuela, Alejandro Gutierrez, Rodriguez Lopez, Dr. Jacqueline Osuna, and Dr. Jesus Ceja. This is one of the unique features that you get with us is that once you submit your HQ, it goes through our surgeon liaison and gets reviewed by the surgeon. And we make sure that you match with the best surgeon for the best procedure. Um, we don't have a limit of what we can do in our center. It's just a matter of which surgeon would be able to do that type of surgery. And, we're not limited, let's say, to do a bypass no more than 50 BMI or not be able to do duodenal switch or certain revisions. And we not like giving you hope that okay, you're going to get this procedure. Once you go down there, say, "Oops, that may not be good for you," and we switch you to something else that is not really suitable for your body. And this is something that is life changing. And if you don't get the right procedure, it's going to affect you for the rest of your life. So you want to make sure you team up with a company who can offer all these type of procedures. And we talked about pre-op diet. Um, our pre-op diet is based on your BMI. And if your BMI is low, close to 30, you basically have to do just a 2-day clear liquid diet. And if you are going to 40, 50, 60, you need to have more weeks of pre-op diet. It's not very difficult. Basically, is a low carb, high protein diet, and maybe maxing your calories to 850 a day. Have more salad, fish, salad, and chicken, and protein drinks. And the better you do on your pre-op diet, the easier the procedure is on you and the surgeon. Accreditation for facilities in Mexico is a huge factor. And if the hospital is accredited by the federal government, which we call COFEPRIS in Mexico, you're up to the standards of worldwide JCI hospitals because they are very careful about every detail of what has to happen in a hospital to be able to be accredited and be licensed. We currently we're using Hyatt Place in Tijuana and Fairfield Marriott, but mostly Hyatt. If we don't have availability, we send you to Fairfield. And this is a hotel that is, well respected. Its service is top of the line. Everyone enjoys their stay there. We give you Jello, popsicle, broth, and your companion, when they stay in the hotel, they will have free breakfast and they'll be well taken care of. On the day you arrive, basically, we do all the pre-ops to get it out of the way. We do EKG and we do blood work to make sure everything is checked. We do check your internist will check you, and then you go to the hotel to relax and be ready for the next day. Next day you show up, we take you to the hospital and we do the procedure. Um, of course, we do all the leak tests in the hospital and we send you back to go back home. And you're flying from San Diego or you're driving back. This we're talking about why NBC, one of the reasons we're so successful is our surgeons load management, which means we cap our surgeries for each surgeon for each day. And that has contributed to our success rate and complication rate being low. Our complication rate is lower than 0.5%, which is amazing. Of course, the hospital, the surgeon, the hospital is only doing bariatrics. They're specialized in that procedure, and the surgeons are dedicated to bariatrics, and they are not doing exhaustive procedures every day. So I'm going to let Dr. Montalvo take over and talk about our surgery options that we offer and go over each one. Dr. Montalvo, thank you for attending. I'm going to let you take over here.
Hi, hello, good morning. This is Dr. Montalvo. We're going to talk about our procedures. We're going to start with the kind of laparoscopic procedures that we make. Some are the gastric banding, the gastric sleeve surgery. This is the worldwide most frequent procedure. Then we have the mini gastric sleeve, the single incision, the RNY bypass, the mini bypass, or also called like the one anastomosis or one connection bypass, the duodenal switch, another kind of gastric revision surgeries, and gastric bypass reversal surgeries. And also we have the endoscopic therapy. There's the gastric balloon, the endoscopic sleeve gastrectomy, and the endoscopic bypass revision. Okay, well, here are some kind of therapy that you can use for the weight loss. Is the diet and exercise in the first Second, we have the medication and pharmacotherapy. Then there comes the endoscopic procedures. And at last, the bariatric surgery. Obviously, as you go forward with this, the risk can be a little higher, but we're talking about right now, the risk on surgeries is like less of 0.5%, like already Ron already talked about that. All right, next. Okay, well, this is some of my information. I'm fellow of American surgeons. I have all the credentials, double board certified, over than 4,000 bariatric procedures. Next. Okay, let's talk about the gastric sleeve. The gastric sleeve, like I already told you, is the most frequently surgery worldwide. The gastric sleeve, with the gastric sleeve, we remove approximately like the 80 or the 85% of the stomach, using from 1 to 5 tiny incisions. These tiny incisions is like 5 millimeters and only 1 or 2 of 10 millimeters. There's where we take out the pouch or the gastric, what we remove. This procedure is a restricted procedure. It means that you're going to list less portions, and the restriction to change the gut hormones that cause hunger and satiety. In the fundus of that stomach that we remove, there goes that hormone called ghrelin. The expectations with this procedure is a high amount of excess weight loss, remove the portion of the stomach with ghrelin. This is called also the hunger hormone. Hold less food and decrease the food intake. You're going to feel full more fast and need some minimal invasive laparoscopic surgery. The pros here can be easily revised if you need it in the future. It's comparable weight loss with the gastric bypass. No changes to the anatomy and less malabsorption, and the recovery is short. This is not recommendable for patients with pre-existing acid reflux or severe reflux or GERD, and it's not reversible. The duration of the gastric sleeve is 1 hour. You will need 2 nights at hospital, and the recovery will depend on what activity you do. You go from 1 to 3 weeks. Next. All right, like I already told you, it's a restricted procedure. It means that you're going it will be less time to absorb. And on your right side, you can see a picture of how is the gastric sleeve. The resect stomach is approximately like the 80%. So in the gastric sleeve, what we call the gastric sleeve, if you see, is like a banana. Next. All right. The single incision gastric is the same, like I already talked about. So, but it's only we only use one tracker or one incision, and there is where we make all the surgery. It's performed through one opening of 1.5 inches approximately wide in the umbilical or navel area. This will be high inside the belly button, so the abdomen looks scar-free. and any drain tubes are removed. And the expectations and the pros and the cons is going to be the same of the previous, of the classic gastric sleeve. Okay, now about the endoscopic gastric sleeve. This is a smaller stomach performed by holding the stomach to create a banana-shaped tube. This procedure utilizes restriction to limit how much the patient can eat at a time. With this procedure, the endoscopic surgeon will put a tube inside your mouth, and there is how he's going to suture inside the stomach, and here is not the stomach is not resect. All right, so the process here is reversible in certain conditions. The reduced complication rate, no incisions, and short recovery time. And the potential risk of partial openings of the stomach pouch can exist. And ulcer too. Talking about the R&Y gastric bypass surgery. The gastric bypass surgery is the classic bypass. Forms a new stomach pouch while the remaining stomach stays in place. The small intestines are rerouted to bypass food digestion, which create malabsorption and reduce calorie intake. The R&Y gastric bypass was the gold standard, or was the first bariatric procedure used to weight loss. The expectations is more significant excess weight loss, new stomach form to reduce hunger and limit stomach capacity. Here, the pouch will be like approximately like the 10 or 50% of all the stomach. It resolves in most of the patients, talking about 95%. The type 2 diabetes, hypertension, cholesterol is better. This kind of procedure is the best for patients who suffer from severe acid reflux or severe GERD. The pros is known as the gold standard bariatrics, improve obesity-related comorbidities like diabetes, high blood hypertension, sleep apnea, PCOS, high success of rate. All right, change of vomit and dumping syndrome can exist, and high risk of ulcers pre-existing. So how you see here on your right, we need to make some connections, like two connections. On the first is to the pouch, the gastric pouch, to the small bowel, and the other will be down of the small bowel. That's why it's called the R and Y, because it's figured like an Y. If you can see both of the Rook's limb intestinal bypass. So the weight loss in all the procedures will be the same. It's not a bigger rate. It's like 1% of difference, but it will depend of what kind of medical issues or pre-existing conditions the patient had. All right. So the duration of the R&Y will be approximately like 2 hours. You will need from 2 to 3 nights at hospital, and the recovery will depend on what kind of activity do you do. It will be from 2 to 4 weeks. Okay. So what's the best surgery for the patient? The best surgery will depend of what pre-existing comorbidities or what kind of medical issues the patient had. So patients if the patient have a previous gastric surgery, a previous weight loss surgery, a severe acid reflux, severe GERD, slow deprivation of the stomach, slow mobility, altered anatomy, previous reverse surgery, previous ulcers, scar tissue. It will depend. Okay, so that's why it's very important the patients put all the informations on the HQs. Next. Okay, the mini bypass or the mini gastric bypass or the one anastomosis bypass or the one connection bypass is a modification of the classic bypass. This is a newest bypass. The weight loss on both of them is the same, all right? So the mini gastric bypass, the upper portion of the stomach to a tube-like pouch which holds only 4 to 6 ounces of food. The intestine is looped to connect with the new stomach to decrease the amount of calories you absorb. Here, the expectation is to reduce the feeling of hunger through the altered gut, early satiety, or feeling full after small portions, reduce calories and nutrient absorbed, and resolve some comorbidities like diabetes, hypertension, cholesterol, PCOS. The pros here is a single anastomosis or connection to the intestines. So it's more safe, more effective, and shorter procedure than the standard RNY or classic bypass. One of the most effective surgeries to reverse failed gastric sleeve or lab bed. Here, the change of vomit or dumping syndrome exists, high risk of ulcers, and change of bile reflux. So here, as you see on your right side, the small intestine will is looped to the and connect to the small gastric pouch, and approximately like the 15–20% of the gastric pouch, and it's only one connection. Okay, different of the RNY that we need to make another connection down of the small intestine for that's for the bile liquid in patient with reflux, acid reflux. Next. Okay, here the best surgery, if the classic bypass or the mini bypass, it will depend too of you if you have a previous bariatric surgery, if you have a previous revision surgery, scar tissue, internal hernia, what kind of comorbidities do you have. So I insist, that's why it's very important to put all the information and surgery information on the HQs. The weight loss will be the same, and the nutritional effect will be the same. Okay, here on the duodenal switch surgery, the duodenal switch, also known as biliopancreatic diversion with duodenal switch, is a powerful weight loss in metabolic surgery. This is one of the biggest surgery because it takes like 3 to 4 hours. We need to make more connections here, like 3 or 4 connections. It's like combinations of sleep and RNY. And it will depend. This is only for select patients. All right. Can you put me the one of the biliopancreatic surgery? Yes, the duodenal switch. Okay. Here, the patient lost from 50 to 80% of the excess weight in the first year. High percent of patients with type 2 are cured after the surgery. And here, the malnutrition is a problem. So patients with this kind of surgery need more follow-up of their physician to take the vitamins, the proteins, blood tests. The pros here is the up of 80% of the excess weight in the first year, the stomach reduced size, highest metabolic effect, and highest effect of weight loss. The cons, like I already said, is extremely strict with the vitamins required for life and higher risk than other bariatric procedures. Why? Because it's a longer surgery, more more connections on the surgery, and obviously this will take a little more higher sort of risk, and hospital will take 3 nights and the recovery is a little more longer. It will take like 6 weeks. Okay, we have more than 10 years of experience here. We use accredited facilities. Our teams use standard infection protocols, screening of all of patients and staff. We have antibacterial stations, fully compliant protective and preventive measures. And about the visitations, some restrictions, all right? The recommendations is to bring and wear your mask, social distancing, the test prior to your travel, and the vaccinations is optional. Obviously, this is to take care of all our patients and our staff. How fast can I return to work after a bariatric surgery? This will depend of what kind of activity do you do. If you're sitting on an office, or you're not lifting, you're on a computer. But from 1 week, you can return. All right, you can return. Yeah, for most of the patients, from 1 to 2 weeks. But if your work is to lifting, fast paces, and you make hard work, we recommend from 4 to 8 weeks for recovery, and it will too depend on what kind of procedure that you have. The first days you're going to feel with not too much. You can feel weak. You can feel not too hard to work, but it will be better in the next days. More after 1 week, your recovery, once your diet progress for soft foods, you take your vitamins, your protein, you're going to feel better to return to work and to do your activities. Okay. Well, Ron is over here.
Hello. Thank you so much for covering the options. I appreciate that. So now I'm taking over because we're talking about financing. Basically, we work with some outside companies to do financing, like United Credit and e-financing. There are other companies that you can get like a personal loan instead of medical loan and like super money. You could go directly to SoFi or Lending Club, Lending Tree. There are all these options. Your bank, actually, I noticed that the banks are trying to get into personal loans like Bank of America, if you have credit union. But the one thing you don't want to do is to apply for more than 2 or 3 at one time, because every time you apply for a loan, obviously it hits your credit and that may not end up well for you. So just be selective who you start the application with and do your research. Um, of course, with this rate increase, it hasn't helped the financing. We see less and less companies or banks want to um, give you a loan. This is a huge part of medical tourism peace of mind. Of course, when you're with NBC, you have that peace of mind that you're working with a company who has been around, who knows what they're doing, and cover all the aspects of um, your movement out there, your surgery, of course. However, it's another piece that it will give you more, um, coverage is medical tourism complication coverage. And we teamed up with the top provider for this insurance, and we offer discounted coverage for you if you sign up with us. And you see the limits they have on each incident, and I highly recommend you take advantage of this. Last but not least, we talked about bariatric vitamins. Bariatric vitamins are specifically made for bariatric patients. It's not something you just buy off the shelf that is like a multivitamin. This is a requirement that your body has after procedure, and our vitamins not only are made with the best ingredients, it also matches the American Society of Metabolic Surgeons, Bariatric and Metabolic, ASMBS certified. So you're getting exact components of what your body needs. We highly recommend for you to start this, and after procedure, for bypass, mini bypass, duodenal switch, this is a must long term. For gastric sleeve, at least the first 2 years. So because losing weight is one component, but the long term success is another component. You know, your bone density, your nervous system, all these you want to be great 8 years, 10 years out. So now we're getting to the part that we promised to answer your questions and Q&A answer. Um, so the first one that we're going to answer, I'm going to probably let Dr. Montalvo answer this one about possible complications from the surgery.
Okay. Well, obviously, as we already talked about, the risk or complications are less of 0.5%. The most frequent complication that can be exist first is the bleeding. The bleeding, it will occur during the first hours after surgery. The second can be the wound infection, and the third one can be um, a leak. But all of this is very, very rare, less of 0.5%. I think the most frequently can be with very low risk the bleeding, but this will be in the first hours, and will be there. So no, don't worry about that. Okay, but it exists. It exists.
Um, they're asking, I've had abdominal surgery previously. So there will be scar tissues. Is there additional cost or cost or risk?
Okay. Obviously, this can difficult your surgery. So it's very important to put this kind of information on your HQ. If you had a previous abdominal surgery and what kind of abdominal surgery do you have? And the cost obviously is because the uh, it is more difficult. We need to clean all the scar tissue inside to perform your surgery. And uh, well, it's all that information is important to put it.
But when we talk about abdominal surgery, it could have been some other surgery beside bariatrics, right? So not all the previous surgeries you've done in the abdominal area is gonna trigger a revision cost.
Yes, obviously, but it's important because and if you have some kind of complication because sometimes in your previous surgery occurs something and that can uh, put some scar tissue. If you have a previous bleeding on a uterus surgery or appendix or open cholecystectomy, all that can occur on inside scar tissue, and it will be difficult to see inside, and we will need to clean all that to access to the abdominal or your gastric and intestine area.
They're asking, is the price of gas, I'm gonna answer this one. Is the price of gastric sleeve and gastric, single gastric sleeve the same? No. Usually is about $1,000 difference between single incision and sleeve. Just be aware that not everyone qualifies for single incision because you have to have a certain BMI. Because if your BMI is too high, it's hard to do a single incision. So if they have had C-section or lateral abdominoplasty, is that going to trigger the revision fee?
I think no. I think it did not affect the C sections or abdominoplasty
Yes.
or plastic surgeries. It's more when it's in gastric surgeries or on the upper abdominal cavity.
I have a clotting disorder and take Coumadin. When have surgery, do you put a plan to stop the anticoagulant and after surgery with Lovanex? So they have clotting disorder and they're taking Coumadin. So are they saying, would you stop the medication and then give you Lovanex? How do you deal with patients like that?
Okay. Patients with this kind of medical issues, we already discussed with our internist, so he can make the recommendations for each one of our patients, because patients with blood clot disorder or who had taken blood thinners. It depends on what kind of blood thinners. It depends on how many days we need to stop them. It depends on what kind of surgery they will have. So this will be very uh, for each one of our patients. But we recommend most of our patients to stop using the blood thinners 3 or 4 days before their surgery, because the risk of bleeding is higher.
Are we able to take anti-anxiety medication the day of the surgery?
Yes. If the patient is very anxiety or nervous, we can put something for them to be more calm.
Will the surgery help diverticulitis? Is the surgery going to help diverticulitis?
Okay, no, because it's a different etiology. It's nothing to do the diverticulitis with the kind of the sleeve or RNY.
Okay, so I see few questions about how do you match me with the best surgeon? How do you match me for my best procedure? What if my BMI is between 90 and 100? Which surgeon is gonna do the procedure? So maybe I go back to the slide that we talk about how we deal with your HQ. So once your health questionnaire is submitted based on certain criteria, we route you to the surgeon that is best fitting your profile. Let's say if your BMI is over a certain number, we know which surgeon is best for that BMI, or which surgeon is actually dealing, not that necessarily is best for that, but that surgeon has that expertise. So they all have certain expertise, but some have some expertise that the other one don't have. So that's why we can cover laparoscopic, endoscopic. We can cover sleep, high BMI, RNY. We can cover duodenal switch. We can cover all the type of revision surgeries because of each surgeon is bringing their expertise to this, basically, to to this to the company. I mean, so automatically we have certain criteria that we send you to that surgeon. Also, our surgeon liaison is reviewing it, making sure that is your best option. Now, as far as, let's say you sign up for gastric bypass, you're still gonna go down there and have a consultation with your surgeon prior to the surgery. And if you have questions, you ask, of course. And if they, at that point, let's say you determine like, oh, maybe I can get by with gastric sleeve. At that time, we're going to give you a gastric sleeve because that's the best procedure for you. We can switch you and no problem. Of course, the price is going to be different. You either have to pay more or get a refund. But regardless, you are going to get the best surgery for you because of the way we operate. So, no, so in the hotel, you stay by yourself, of course. If you have your companion stays with you, and then once you go to the hospital, your companion stays in the hotel, come to visit you certain hours, but that's where they stay. As far as stopping smoking, at least 4 weeks. I mean, I'm going to let Dr. Montalvo, if you have I think the longer you stop the smoking, the better for you.
Yes, because this smoking, it will affect your healing, has internal and external healing. It can affect on blood clots, affect on your lungs, remember that you're going to have a general anesthetic. So you will have a tube inside your mouth, and our anesthesiologist is going to help you in all that time. And after your surgery, you will need some to do some lung exercise. So if you continue with your smoking, it can affect since your surgery and after surgery and your recovery. So we recommend to stop using 4 to 6 weeks before the procedure.
So they're asking if I have had my gallbladder removed and my appendix removed, am I still going to qualify?
Yes, obviously. There's nothing have to do with your weight loss procedure or different surgeries.
Do you remove gallbladder if it's necessary?
If it's necessary, yes, we remove the gallbladder at the same time. If you have previous issues with your gallbladder, if you have an ultrasound that indicates you have gallstones, previous pain, it's recommendable to take it out and at the same time.
So what about pregnancy after gastric sleeve?
Will be better because obviously the weight loss, the hormones go to your normal levels, and there will be changes on your endocrine system. So patients who had under bariatric procedure have more chance to get pregnant.
I've had 2 cesareans and gallbladder surgery. So how much? So I don't think. So does gallbladder surgery triggers a revision fee? If they have if they have had a gallbladder removal before?
No.
No. So this patient is asking, they have had a thing called rumination, which they spit up the food and then they re-chew the food and then they swallow it again. Is this considered GERD?
Well, let me look this. Where is it?
Right here.
So I can read it. Rumination disorder consumers spits up food from the stomach, chews it, and either swallow it again or spit it out. Is this GERD? Well, it can be considered, but it's important to have previous studies for this kind of issue, medical issue. Let's go from endoscopy, some X-rays, because if you go for a bariatric surgery, yeah, we need to know if this will disappear or it will stay or it will be worse. That's why it's very important to go with your physician and to start a protocol of this kind of issue.
Okay, so talking about pre-op labs. So we are going to do, we are doing a blood test and EKG and check you up when you come in. And one day, of course, is enough. However, for patients, especially for patients who are coming for revision, we recommend that you do a blood test before you come in case your hemoglobin levels are low. You would take care of it before you come. Of course, if you come and if that's the case, we can do a blood transfusion, but it's better if you know and take care of it before you actually come there. So that's one thing we recommend for you to do. Not mandatory, but is a good idea. Um, so when you go back home, the only thing you have to worry about is, of course, have another maybe 3 months to 6 months visitation with your general doctor. Make sure everything is checking as far as your blood test. But if you feel um, like, you have a fever, you have some kind of a problems like that, you definitely want to go immediately to a hospital where you are. And that's the one thing you need to watch out for. But other than that, just take care of your wounds and make sure your post-op diet is according to what we recommend, which is coming from a liquid to solid in 4 weeks. That's huge, not lifting heavy stuff for a while. Again, you have to listen to your body and just be mindful of what you do. So you saw the medical tourism insurance, which we call MTI, covers for some travel-related incidents and some coverage for complications if you have it. Of course, they have like 45 days after the surgery, they cover that. So basically, if you have anything, best thing to take care of it first and then file for insurance to get reimbursed. They're saying what happens if diet is not followed 6 to 12 months after? I know some people who stop following the diet and their weight loss has stalled. What are the complications of not following the diet in the short and long term?
Well, remember, this is a tool. Your surgery, your procedure is it will be not magic. After surgery, it's very important to continue a nutrition plan and to make some kind of activity or some kind of exercise, but continue your moving your body, all right? If you don't follow these indications, your procedure will fail because in the first months you can have some weight loss, but this depends of the calories that you take. If you make your surgery, but you take your more the calories that you need, or don't follow the instructions or the indications, this will fail your procedure. So that's very important to do.
Okay, so once you are qualified and the surgeon approves your health questionnaire, you could do the deposit, and it's usually 350 or 500, depends on which way you want to go. The rest is due 2 weeks prior. So now when we say 2 weeks prior to the surgery, let's say if you are taking a cashier's check to Tijuana, you need to send us a picture of it so we know, like, oh, this is how you're going to pay, or whatever, however you want to pay. So 2 weeks prior, we either have to have the payment or know how we're going to get paid. As far as extra fees once you go there, the all-inclusive package comes with a standard medication, pre-op test, post-op test, as we mentioned. However, if some people need some more medication because of their condition or some things like that, there's going to be, of course, additional fee for medication. It's not going to be much unless you need a whole lot of stuff. And again, let's say if the surgeon finds a hiatal hernia, which is probably that Dr. Montalvo can explain more, hiatal hernia repair is huge for you to be successful after gastric sleeve. But if they find the hiatal hernia, for example, during the surgery and they fix it, there's going to be extra charge. It's not more than $300-400. So these are the extra charges that it may kick in for you.
Yes, yes. Sometimes patients don't know they have the hiatal hernia, and it's finding during surgery. Once we go in with our video laparoscopic, it's very evident the hiatal hernia. The hiatal hernia is a hole on the diaphragm, and it's very important to be repaired during surgery, because the pouch can go through that hole to the thorax and then can be an emergency. So, and to prevent if the patient have previous GERD, or it can be worse. So it's very important to repair it during surgery.
There is no requirement of having a certain A1C level before surgery, because that's actually why you do the surgery, to bring down your A1C. So does you know how we talked about stopping smoking before surgery and after surgery? Does that apply to marijuana too? Do they have to stop marijuana? Or
yes, all that like substance or
substance abuse? Yeah.
substance, yes, we need to stop use it, obviously, because all that is absorbed by your body, and it can affect more with marijuana. It's more we saw more side effects like bleeding. So that's why it's very important to stop using from 4 weeks, 6 weeks before your procedure and after your procedure. And obviously this affects your recovery.
So they're asking about the difference between endoscopic and laparoscopic surgery. So let me go share this screen here. Sorry, gotta get it from here to here. There you go. So this picture shows kind of the difference between laparoscopic and endoscopic. Dr. Montalvo, you want to explain this?
All right. Here, these pictures are very important. More the first one, because on the open bariatric surgery or any open surgery, most of them will have a fee. Why is this? Because as bigger your scar is or your surgery was, more inside the scar tissue will be. And if you see the first picture, and this is an open surgery. The open surgery was surgeries performed before the laparoscopic surgeries, was bigger incisions The laparoscopic surgery is the second one. These are very tiny incisions on your abdominal cavity. It can be from 1 to 5 or 6. It depends on what kind of previous procedure you had. And the single incision, it will be only one incision, and it will be on the umbilical or navel hole, and then there will be, obviously it can be some scar tissue inside, but no, it's more. That's why it's better all these newest kind of surgeries and the endoscopic procedures. The surgeon or the doctor will put inside your mouth a tube, and he will perform from inside your stomach the sutures or the gastric sleeve or the RNY or the bypass revision by endoscopic. This means by a video put on your mouth and go through your gastric pouch. There's no outside or abdominal incisions.
Thank you. So let's go back. So yeah, so we talked about anti-anxiety, mood stabilizer prior to and after surgery. You talked about that. What type of anesthesia are used for gastric sleeve? Spinal or blocks or what?
No, it's general anesthesia. In all our procedures is general anesthesia.
So, okay, so let's say you're flying to San Diego International Airport. So basically Southwest is going to Terminal 1 and almost all the other airlines go to Terminal 2. Terminal 2 is a newer terminal. Terminal 1 is kind of, is actually getting remodeled, which is a mess. If you've been down there. So hopefully once they finish the construction, is going to look very nice and it'll be more easy to get in and out. Well, I don't know if it's going to be more easy to get in and out because you know how they make it complicated. But right now, if you fly in and basically you have the driver's phone number because they have contacted you the day before your departure. So you have their information, they have your information. And basically once you land, if you have checked in your luggage, you go pick it up and go to the curb and tell the driver what number on the sidewalk you are, because they'll have letters like C, D, E, F. Say I'm at the F, and they come circle around and pick you up. So that's how you get picked up, no problem at all. So right now it's very friendly. Even if Terminal 1, you come out, Terminal 2 is a little more walking, but you come out and you see the sidewalk and the driver come right there and pick you up. If you're driving, which is sometimes people do, you basically again you park somewhere and you drive to the airport and they pick you up from there. Some people opt to actually drive all the way to our facilities in Tijuana, and that's possible too. And if you were to fly to Tijuana, also we could pick you up from the airport in Tijuana, that's rare. But pretty much, these are the options. Trying to answer as many as possible. So they're saying I had tubal ligation through the belly button. Is that a problem with scar tissue?
No, because the that kind of surgery is down on the pelvic side. It doesn't affect the other kind of surgery.
Now, sometimes if you don't have option to get there in time, some people opt to come the day before, or the same thing when your departure. If your departure cannot happen around 1 or 2, you can stay in San Diego. Um, there's a Hampton Inn. They have special rate for our patients. Of course, during the pandemic when they were not busy, they offer 119 plus tax to us. And now that they're busy, they're like very hard to get. But anyway, you can stay there, and I think they have a shuttle that comes, either that or Sheraton by the across the street from the airport. So they're saying, how is the pouch secured? Is it stapled, stitches, after gastric sleeve?
Yeah, both of them, and in every procedure, gastric sleeve, bypass, mini bypass, in all of them are staples, and after that we suture the staple line to prevent bleedings and obviously leaks.
So when can we start using scar cream for the incision marks?
After the 6 week, once the the scar is well good tissue or scar tissue, you can start using the this kind of creams.
So what is done for pain control in the hospital?
We have a lot of medication for pain. It depends of what if the patient have any allergy or what kind of medication is better for them. But we have a lot of medication for pain. Obviously, nausea, antibiotics. We have all that.
So I had lumbar back surgery. Is it possible to place support under my legs?
Yes, and it's very important to mention this to our anesthesiologist so he can uh, take measure all of the medication and the position to you to be more comfortable.
I'm allergic to opiates. Can your anesthesia team provide synthetic alternatives?
Yes, obviously.
Okay. So we got answered that. This person asked, as an infant, they had intussusception surgery. Yeah.
Yes. Well, let me.
It's right here.
Yes. Well, surgery is a major factor. Well, for uh, for a sleep, this will depend of what kind of procedure uh, your pediatric surgeon did. If you have if they was a they did a an open surgery, uh, if you have if you want a gastric sleeve or a RNY, it depends. We don't know inside until we go in to check the scar tissue inside. If there is if you want or you choose to make a gastric gastric sleeve, there's no major problem. But if we need to move the small bowel, maybe there's can be something inside. It depend of what kind of procedure you had.
Okay. They're asking, what about THC? You know, I think we talked about smoking, and so they're asking, do they need to discontinue THC before surgery and after surgery? So they're asking about our new surgery center. This surgery center that we're working on is the state of the art, and it has all the best and the latest equipment as far as this is a glimpse of the patient's rooms. Um, yes, and you know, for example, for sterilization, we be using the latest and the best plasma, steam, gas sterilizers. Um, as far as, for example, they're asking about, is the OR tables are equipped to take patients of 600 pounds. Our OR table are ordered as we're talking, and they can take all the way up to 1,000 pound capacity, and they're state-of-the-art OR tables, and they you know, they're the best you can get right now anywhere in the world. And so anything in the hospital is made with the best of the best and the highest quality, as far as backup generator, uh, you know, water filtration, um, anything you can think of in the hospital is top of the line, and it's a game changer. Um, but yes, we will be able to offer patients with high BMI in there. So we are almost to the end. I mean, there are some more, a little bit more questions, but I think that's about it. So they're asking about when they were younger, they had hernia repair on their belly button. Uh, do you think still be there?
No, it's very rare. It's very rare that you still with the hernia, but doesn't affect your procedure.
Again, the post-op diet, you want to go from liquid to solid in 4 weeks. So make sure you comply with our diet instructions. We do have a nutritionist in-house. She's great. You can reach out to her for any questions you have. Also, she has regular bi-weekly or weekly webinars that you can jump on, and she'll go over all these pre-op diets and post-op diets, and you can ask questions. Thank you so much for everyone to attend. And I am going to do the drawing now. So just there you go. I have all the names that are eligible for this drawing in here, and I am going to pull one name. We'll see who is the lucky winner. Of course, you guys are all Genevieve Garner. I hope I said the name correctly. And I'm going to try to all right, so there you go. I'm going to allow you to talk. Please talk to us and make sure I said your name
Hello.
correctly. Hi, how do you say your first name?
Hi. That is correct. You can also call me Jenny.
Jenny. Okay. Hi, Jenny. How are you?
Hi. I'm well. Thank you so much.
Okay. So tell us about where you live. And more about yourself.
I am in Vancouver, BC, Canada.
Wow.
And yeah, and my sister actually got this surgery done 1 year ago, and she is absolutely in love with it. And she's just, it's given her so much quality of life. So she referred me, and I'm so happy that I did the webinar.
Yes,
I
thank
was
you.
very excited.
Yes. So when do you think you'd be ready to do the surgery?
I would like to do it for the new year. If it's my idea, is when I'm thinking in January.
Okay. Yeah. So yeah. Let's talk. I would have. I don't. Do you know who is your coordinator? Did you fill out it before?
Yes, I have. I believe my coordinator is Megan.
Oh, okay. Okay.
Yeah.
Yeah. So we let her know, and please
Okay.
be in touch with her to get arranged to come down. And so yeah. So we appreciate you and everyone else to join us in this
Yeah.
webinar, and hope to see you down there. Thank you,
Great.
Dr. Montalvo, for your time. We appreciate you. We appreciate for all the work you're doing for us and for patients. Thank you. Thank you
Absolutely.
all.
Thank you, guys.
Bye-bye. Bye.
Bye.